is a patient from MTC that was referred to us, and she ended up with a beautiful smile. And this is her final smile. This is Carol is one of our technicians, and what she's explaining is that she receives the images that we produce on the clinical case, and here they are processed for the crowns to be fabricated. I can show you step by step. Once the image is gets to our premises, she is going to make the image more clear, and this image is sent to our technicians to Europe. We have 3 technicians, 2 in Spain and 1 in Italy, that make the design of the crown. So this information, once it's clean, is going to be sent to Europe, and once the crown is designed, we're gonna get it back a year, and we're gonna start the process of actually manufacturing the crown. While the design is being made in Europe, what we're gonna do is produce a 3D mold with a 3D printer, which I'm gonna show you in a minute. And once the image gets here, Carol is going to process it and put it in one of our milling machines. So here you can see the milling machine that is producing a crown in zirconia. So which is a block of zirconia before being centerized, and the crown is being milled by the contour based on the design that was made by our technician. Once the crown comes out of here, it's gonna go to the next room where the color and finishing is going to be applied for it. Once the crown is milled, it comes out on these blocks. For each one of these holes used to have a crown. So what he does is he cuts the crowns from these blocks, mills away the connector, and from here is placed on the ovens for the zirconia to crystallize and become hard. Here, Maria Fernanda, that is one of our techs here, is coloring the zirconia before being centerized, and that's gonna help us deliver the beautiful smile. So usually when we're seeing a patient, the dentist the shape of the teeth, and once it's chosen, here the technicians have the same guide, so they can deliver the color that we want or that the dentist is requesting, and to match it. Once the crown comes out of the milling machine, and it has been, the colors have been added to it, we need to put that material into this oven, and what it does is going to centerize the zirconia. In other words, it's going to make it strong. We have 3 different centerizing ovens, so we can manage the volume of crowns that we have in the lab. And one important thing to mention is that here we work with Circonsan, that is an Italian company, and that allow us to ensure that the quality of the zirconia that we are using and the whole process is being monitored, and we can achieve excellence on the results that we are providing to our patients. Is a patient from MTC that was referred to us, and she ended up with a beautiful smile. So as you can see here, that's her before, the way she was smiling. This is a close-up of her smile at the moment that she came to the clinic. This is with the retractors, and this is her final smile. We restore all of her upper teeth. This is a closer image of her smile, and this is with the retractors. When she came in, we took pictures of her, we took x-rays, we determined what our final treatment was going to be. We explain, or we take our time to explain very well to the patient what she needed. She agreed with the treatment. So on that first day, what we did is we prepared all of her teeth. We grind them down to make space for the crowns. On the following day, we did the root canals that were needed. In her case, she needed 2 root canals. And on that day, we took final impressions or final molds. From that point on until the following appointment, we made quick temporaries that were based on what the patient had in her mouth. But on the following appointment, 3 to 4 days later, she could actually already see what she was going to look like, because we had already the computerized plastic material milled, so she could look at her smile, see if she needed any corrections, and as well as us make any adjustments in her bite. We thankfully are very good at achieving good aesthetic results with the team of lab technicians and the teamwork we do here with our dentist. So I would say 95% of the time patients are very happy with what they see, and we don't need to do any adjustments. And 5% require very small adjustments that we can do right away. Seldomly, the patient is very picky, and then we need to do many tries, and that will elongate the travel time, because we need time in order for the patient to see and approve what they're looking for. In this case, the patient was extremely happy with what we delivered. In this specific case, she did not need any implants. We did everything tooth supported with bridges and crowns. In her case, we did a total of 14 teeth. 2 of the teeth were breached.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.